African American men have the highest incidence of prostate cancer in the world. And when we look at the numbers for African American men and prostate cancer, African American men are 74% more likely to be diagnosed with prostate cancer than white men. Also, amazingly, African American men are twice likely to die from prostate cancer than white men. We asked the question why African American men are at a higher risk of prostate cancer versus white men, but unfortunately at this time the causes are largely unknown. Numerous studies have looked at patients with similar income and education, and they have shown that African American men still have a higher incidence of prostate cancer versus white men. So when we're discussing early stage prostate cancer, there are no early warning signs or symptoms. Therefore, it's very important for African American men in particular to pay attention to their body, to actually see their physicians, and to undergo prostate-specific antigen testing, or PSA. Unlike early stage prostate cancer, late stage prostate cancer can have warning signs or symptoms. They can include urinary symptoms such as urinary hesitancy, urinary frequency, and/or blood in the urine. If the prostate cancer extends beyond the prostate, oftentimes patients can present with bone pain or back pain because the most common site of metastases is bone mets. There are no definite ways or interventions to prevent prostate cancer. We do know diet and healthy lifestyle plays an important role. Eating a more plant-rich diet and staying away from fatty foods and fried foods definitely will play a role in helping decrease prostate cancer. So there has been a recurring debate in the literature over the last 5 years regarding prostate cancer screening. Given that we know that African American males have a higher risk of prostate cancer, we believe that prostate cancer screening cannot be ignored in this population. The American Urological Association recommends in asymptomatic men of average risk that prostate screening begins at the age of 55 to 69. However, we do know that African American males are at a higher risk, and so we believe that they should start earlier. I'm happy to report much is being done to raise awareness of the increased incidence of African American males with prostate cancer. The 14th Annual Prostate Health Education Network Summit was held in Washington, D.C. in September of this year on Capitol Hill. This was a group joining of physicians, prostate cancer survivors, and leaders in the medical, pharmaceutical, and in government coming together to look at policies and procedures regarding prostate cancer, specifically in African American males. The other exciting thing is that this initiative is to try to promote enrollment in cancer trials, specifically targeting African American males with prostate cancer. As a radiation oncologist who treats prostate cancer, I am very encouraged at the increasing awareness and support that's going into tackling this disease that affects African American males with prostate cancer.